pack. We're going to be talking about Chapter 2 out of the Shilen book, and we're going to be talking about directional terms. So I'm going to kind of go through that a bit, and we're going to also talk about some medical abbreviations. I say to one set of my class, I say it to this class as well, and to you out there that may be viewing this, that it's good to have a medical abbreviation dictionary. Now, I know the year is 2018. You could probably get away with it being a 2015, 2016, 2017. But if you can keep it as current as possible, great. Anytime you work in a doctor's office or code, hospital coding setting, or any kind of billing setting, you want to make sure that they have some sort of medical abbreviation dictionary. In that medical abbreviation dictionary, it has a standard of abbreviations that everyone uses across the board in all the hospital settings and all the medical settings. So you can understand what some of those medical abbreviations are, okay? And I say that to all my students. You can go to half price books. It's not necessary to buy the most expensive one and keep one. The editions, it doesn't matter who the author is. The editions may be a little different, but they should be a standard. So whatever facility you work for, make sure they supply their own medical abbreviations dictionary. If not, then you can buy one, but I would have them reimburse me post-tax, because you pay tax on that. That's business, okay? Or they recommend them to buy it, so that you can do your job more responsibly and more efficiently. Okay, so super fantastic. So we're going to look in the Shilen book, and we're going to talk more on terms about medical abbreviations and directional terms. Okay, so I'm going to write a list of medical abbreviations on the board. Again, I am not a video aficionado, so I deeply apologize if you can't see the board as close as I would like to get it to you. So sorry. If you can kind of adjust your lens on your end. If not, it's very okay. So let's go. So the first list that I want to make here, and I will put it on this screen right here, that I talked about earlier today. And again, you're probably going to ask me, well, Ms. Harper, it's not exactly in Chapter 2. I know. Well, Ms. Harper, why are you telling us all this? Because there's a method to my madness. There's a method to how I teach and why I do what I do. Because it's going to all tie in and make sense, okay? So here's a list of abbreviations. All right, so we have DX, we have PX, we have BX, we have TX, we have HX, SX, we have EMR, we have EHR, we have RX, okay, PBMR, you have SOAP, SOAP, and another term for SOAP notes is progress notes. Okay, great. We also have CC. CC means chief complaint. You have vital signs. Okay, so we're going to talk about what are vital signs. Real pertinent for you to know that, so you can understand the progress note in its totality. You're going to understand return to office, ROS, review of systems. Okay, review of systems. Okay, so these are some of the medical abbreviations that are going to be in your pathology class. And so today, on Mondays, we're going to be talking about anatomy-physiology, and then also on the same day, we're going to be talking about pathology. So that's part of what we're learning today in the appendix part of the Shylin book, is the medical abbreviations, okay? And also with pathology comes labs and things of that nature. So we're going to talk a little bit about that and how coding can take place from that. You can pretty much figure out what's going on with a person's, their diagnosis and what's going on with them, okay? All right, so for diagnosis code, DX. DX means diagnosis code. Okay, I hope you all can spell this correctly because it's going to be spelling a quiz on Wednesday. PX means procedure code. Okay, BX means biopsy. TX means treatment. HX means history. Okay. SX means surgery, not sex. Surgery. Okay. EMR means electronic medical records. Okay. EHR means electronic health record. Okay. RX means prescription. PBMR. PBMR means patient-based medical records. Patient-based medical records. Patient-based medical, Okay, so notes means, again, subjective, objective, assessment, and plan. CC means chief complaint. Vital signs. Vital signs means temperature, pulse, respiration, blood pressure. Okay. RTO. RTO means return to office. ROS means review of systems. Okay. Now, you've gotten a taste of pathophysiology inside of this. Okay. So now we can delve more into directional terms. So let me get my book out here. And here's my book for chapters 1 and 2 for this class. Okay. So we've already talked about introduction to healthcare terminology. And for my blended class here, you all have specific assignments that you all need to do. My other students, you all have other online assignments that you're doing that's online with the book itself. So you all should coordinate with that. Okay. All right, so you have some translatable terms on page 3 of your book. So if you can open up your electronic book to page 3, we have cataract, asthma, diagnosis, prognosis, and sequela. Okay, so cataract means waterfall. So in healthcare language, it means progressive loss of transparency of the lens. Cataracts has something to do with the eyes, okay? And so you need to have that looked upon, okay? Asthma, those are some examples. It means respiratory disorder characterized by recurring episodes of paroxysmal dyspnea, which is difficulty breathing. Okay, this is like going without air or short amount of air. Okay, then you have diagnosis. Diagnosis is a disease or condition that is identified after a healthcare professional evaluates a patient's signs, symptoms, and history. Okay, so the more you escalate in coding, the more you're going to understand signs and symptoms and history. Okay, it also means through or complete. Gnosis means state of knowledge. All right. Now you have prognosis. Prognosis is similar to diagnosis. It is a term to be broken down, which means that the state of knowledge. Okay. So this does not give the true definition of the term, but it is a prediction of a probable outcome of a disease or disorder. So the doctors say she has shortness of breath, she looks pale, or she looks like she's turning blue, and it's cold outside. It's a lot of hay fever going around. Maybe his prognosis is that she has asthma until he through lab test done to figure out if that person has some sort of onset of asthma or maybe some sort of pulmonary infection. Okay. All right. Sequela. Sequela means to follow. A sequela is a condition that results from injury or disease. Pardon me for a moment. Okay, I'm going to step away for a minute. Hello. Okay. Thank you.
That was from February.
Yeah. Thank you.
Okay.
Yeah. Everybody else is free. Oh. Yeah. Yeah. You're welcome.
So yeah, we're taking our certification exam.
Okay, hold on just a moment. Yeah, I know you have a question about that. Put a pin right there and let me finish this up. And then we'll come back to you. I'll come back to you. Okay, so sorry about that, class. I got interrupted. And we'll come back to your question once we finish with the video. Okay, so late effect, sequela, it's late effect. Okay, so again, we're going back to that previous example that we have. Johnny had fractured his arm, and now it's a year later, and he's getting this terrible squeezing pain of his arm, and he doesn't know why his arm is squeezing, but he explains to the doctor that he had a previous injury, and so now something else is going on with his arm. Okay, that is called a sequela. Okay, so I'm going to let you all read for yourself. It's pretty much self-explanatory. The lessons in here, exercise 1, I really would admonish y'all to do all the exercises in here. In chapter 1, introduction to healthcare terminology. I may even have some sort of test for you all to do on top of the quiz that I plan on giving to you all for this. Fantastic. Okay. All right, so now body structures and directional terminology. Okay, so you have different types of tissue. So I'm on page 29, chapter 2 in your book. So you're talking about epithelial cells, okay? So inside the cheeks of your mouth, you have epithelial cells. And I think we talked about that once before. Did we not talk about that last week, about epithelial cells? And epithelial cells are, to me, in my corner phrase and looking at this book, it's more of a self-healing, self-replicating type cell. It heals very quickly. You could scar on the inside of your cheek or whatever, maybe the inside of your intestines, and it tends to replicate really quick, okay? Then you have connective tissue, you have muscular tissue. Connective tissue is a variety of types of internal structure network, which combines the bone and the blood and the fat, okay? It makes them all connect together and harmonize, okay? So you have those different tissues. Then you have muscular, which is the heart, the skeletal muscular system. Visceral, then you have the nervous system. So you have the different types of things. So just imagine that your body develops from cell to tissue, from tissue to an organ. Okay, how great is that? Okay, so different organs such as the heart. Okay, that's an organ. The stomach. Okay, the brain, the reproductive area, the kidney, those different things. All those makes up part of an organs that all comes up from a cell to a tissue, and from a formation of a tissue to an organ. Okay, your lungs, all those beautiful things. Okay, so you have the different types of tissues, intracellular functions, and organ parts. So you need to learn that in chapter 2. Body systems, and again, I said that there's 12 body systems. Now, when we did that chapter 1 illustration, explained when I talked about the SOAP notes in the assessment part, and the doctor had asked him how did he feel. He asked him basically, he tested the nerves in his arm, different things like that. And so he did the nervous system, the musculoskeletal system, and the skin to see how well his skin is holding up during the healing process of his fracture. Okay, so 3, and I think maybe 4 out of the 12 review of systems, the doctor was trying to see based on his conversation with the patient and the nurse's conversation with the patient of what he needed to review for his chief complaint for being in the office that day. Okay, so we have translating terms such as cytology, which is dealing with the cells, the study of cell, pathology, which is dealing a pathologist, which is the study or a specialist that deals with pathology, necropsy, histologist, biopsy, all those wonderful things deals with the tissue and the examination of the tissues. Okay. All right, so you have different terms of the body. So we're going to move right along here. There are certain terms that I really want to get to. Okay, so you have anterior, you have posterior. You have superior, you have cephalad. You have inferior, you have caudad. You have medial, you have lateral, you have ipsilateral. Okay. Now, when doctors dictate their notes, their operative reports, perhaps their history and physicals, they're going to talk about which direction of where the person's body that they're being treated for. And so you have to kind of understand, and they show beautiful pictures here of how these directional terms match up with these words. So you have to understand and picture in your mind what they are talking about. Okay. Now, I used the perfect example of the show. Have you ever seen, what is that show? The Good Doctor. Have you ever seen The Good Doctor? Okay, okay. Well, this show, The Good Doctor, this physician has autism, and of the autism, he can picture the parts of the body, the functionality of the body, and he could tell you what's going on with that. Okay, and so that's how that goes. So you have to kind of picture in coding and in billing how that body goes and how to go about doing the code. Okay, and so we're going to move right along. Oh, great. Positional and directional terms, word parts for positional and directional terms, operative report on page 45. This is great. You all get a chance to talk about what I'm lecturing about in this operative report. So you have a pre-operative diagnosis and a post-operative diagnosis. Pre-operative, pre means before, post means after. So in this scenario, for John Greco, that's in this book, page 45, the patient had esophagitis with stricture. This was before the surgery. After the surgery, the same, along with gastritis. So he's had an upper GI endoscopy with a biopsy. And so inside of this operative report is giving you the age of the patient, is giving you the history of his issue and what the findings were, and how he recovered from the procedure itself, and then they close it out. Now, operative reports have to be done within a certain amount of hours, a certain amount of time. If it's not dictated immediately, then the doctor has to remember within a certain amount of hours and time to write or dictate what happened with that patient. After so many hours and so long, he tends to forget. Okay, so that goes on with operative reports. You find operative reports more so done on an acute level and maybe an outpatient surgical level. You're going to find some operative reports in a physician's office in order to know how to charge for that physician's time working in the hospital and making his rounds in the hospital. Okay, you have different cavities of the body, which is thoracic, sternum, mediastinum, different things of that nature, pelvic cavity, okay, the cranial cavity, the spinal cavity that's dealing with the brain and the spinal cord, the sternum that's dealing with the chest, the mediastinum that's dealing with where the heart is located, the abdominal pelvic that's dealing where the stomach and the lower intestine, large intestine is located, pelvic cavity that's dealing where the reproductive area of the body is located, okay? Then you have the abdominal pelvic regions of the body, okay? And it has its quadrants. It has 9 quadrants. So again, I'm talking from the right side of my body, okay? So on the right side of my body, I have the liver, okay, on the right side of my body. So this is the right hypochondriac region. You have the right lumbar region, which is my large intestine, small intestine. So you have the intestines that go transverse sagittal sinus, ascending, descending. It goes into a nice big loop there. Then you have the right iliac region. So that's talking about where my appendix is, okay? For those that may have appendicitis or may have had their appendix taken out, that's where they're gonna go and cut you. Okay, epigastric region. Okay, that's where they go right there, and they may do some work on your duodenum. They may go and do some work on your jejunum area. Okay, your umbilical region. That's where they go in laparoscopically. They may do some things through your belly button, some surgical procedures through your belly button. Your hypogastric region. That's right up above, right where your reproductive area is, but it's your large intestine. It sits right there, right on top of your reproductive area. Then you have the left hypochondriac region, which is where your pancreas is, where your other areas of your body, the fundus of your stomach is more located on the left hypochondriac area. The left lumbar area dealing with the small intestine, large intestine, and then the left iliac region. Okay, so those are the 9 regions. That matters a whole lot because you can say accidentally a patient can be accidentally operated on and said, oh, well, the doctor operated on the patient on the left side of the body of their liver. Really? He went on the left side of the body to get to the liver? Oh, I would be scared. Okay, now moving right along, you have the 4 quadrants of the body, which is the right upper quadrant, left upper quadrant, left lower quadrant, right quadrant. And again, if you ever notice doctors before you have surgery, and I've had some in my day, where they will mark a certain area to remind them this is where they need to, how can I say, assault you is what we say in healthcare terms, voluntarily assault you. So that's what we say in that. So other directional terms, mid-sagittal, frontal plane, transverse plane.
Full house.
I know. Hold just a moment and we'll come right back to you. Oh, say hi, Dr. Lucklani.
Hi.
This is our school president here. And so he's happened to catch me by surprise. So
That's okay.
I'm going to catch.
Who am I talking to?
This is to my YouTube family.
Hello, YouTube world. So can you pause it real quick?
Yes. Yes. Give me just a moment.